So overall, it's estimated it's one of the main factors. And when you look at the studies which are already published, they say that majority of patients will feel that there are certain foods, there are food triggers which are causing their problems. The issue is to identify these food triggers, and this is so we will study on its own, I guess. So we know that many patients perceive that gluten or wheat or similar cereals are triggering their symptoms, and we definitely know from other diseases like celiac disease that this specific protein gluten, which is found in wheat, can trigger immune reactions in patients who are genetically predisposed. And in celiac disease, we really know what is the sequence of events and what can be targeted therapeutically. In IBS, we don't know what the mechanism can be. And there were some earlier studies, and we also use the information from another disease, which is called non-celiac gluten or wheat sensitivity. And some of these studies show that there is some immune component of it. There can be some immune activation in patients who report symptoms after ingestion of gluten. But I guess it doesn't apply to everybody. And what you already mentioned, the gluten-free diet is trendy, and there are many um, um, reports on internet. There are many blogs which suggest that gluten is overall unhealthy, and that can have many effects, whether triggering really the pain, bloating, affecting muscle strength, and leading to weight gain. So, and many of these claims are unsupported by any research. So, many patients probably will try to use these restrictive diets in order to have any relief in their symptoms. But again, it's trial and error, and I think that the beliefs play significant role in many of these patients who start and stay on these restrictive diets. So this study was actually designed to better understand what components in wheat can trigger symptoms. And I already mentioned gluten, which is one of the main immunogenic proteins, but there are others, among them uh, ATIs, amylase trypsin inhibitors. And again, there were studies showing, especially in animal models, that they can trigger very specific immune reactions. So this study was actually follow-up of our previous trial, which we did several years ago, when patients who improved who were patients with IBS and were put on a gluten-free diet, a proportion of them improved. And those who improved were more likely to have this marker of immune reactivity, specifically anti-gliadin IgG antibodies. So the study which we now performed, or which was just published, was designed to study whether there is any role for these additional proteins or additional components in wheat which can trigger these symptoms. So this was a triple challenge study, and in a random order, the patients were challenged with either purified gluten, so really without any other components, or with whole wheat, which contained gluten but also ATIs and other possible immunogenic proteins. And of course, we had a control group, or control challenge, which was a sham. And what this study showed uh, that similar proportion of patients reacted to all three challenges. So, which was a big surprise to us because the patients whom we invited to this study were all patients who felt that avoiding gluten makes them feel better. So many or most of these patients were on a gluten-free diet already for many years. There was also a proportion of patients who started with a gluten-free relatively early, but this was really patients with self-perceived gluten sensitivity. So I think there are several things which came up from this study. So specifically for gluten sensitivity, um, so probably only a proportion of patients who feel that gluten is really triggering the symptoms. So only in a proportion of them, the gluten or wheat, other wheat proteins will be the real culprit. In many of them, it will be a really just the belief or the perceived nocebo effect, and really there is an effect of um, internet and negative um, negative influence of celebrities which may cause this. Um, the other thing is because in our study had actually two parts, because first we tested whether the gluten or wheat has any effect, and in the second part we actually told the patients whether they are reacting to gluten or not, and 1 month later we asked them, did it change your behavior, your dietary choices? And to our surprise we found that most patients actually did not. And even if we told them that they have not reacted to gluten, or they reacted to all three challenges equally, most of them still stayed on a gluten-free diet. So for me, it shows that if we do studies like this, or if we implement it in the clinical practice, then we have to continue working with the patient. So we have to guide them, maybe to reintroduce certain foods back into their diet. They may need psychological support. So it's not just enough to tell them no, gluten is not doing anything in your case. Just stop a gluten-free diet. So the beliefs are strong, and we have to take it into account.